Huron's webinar entitled Moving Forward During COVID-19 Pandemic. This is the second in our research compliance webinar series, so there is more to come. Please stay tuned for that. As Grace said, my name is Leah Guidry. I'm one of the managing directors with Huron's research services practice. Our research services team is comprised of over 400 people solely focused on serving the research industry. That's all we do. And we're comprised of consultants, software, and an outsourced business to serve our university, AMC, hospital healthcare system, and research institute clients. I am the co-lead of our research compliance team and concentrate my practice in compliance, risk management, investigations, and defense support. I'm joined today by three colleagues. Chris Steele is a director on our team. Throughout his 12-year career at Huron, Chris has assisted and guided universities, hospitals, research institutes, and nonprofits in research administration operations, with a focus on financial and operations areas of pre and post-award grants management. So all of our grants issues and grants questions will direct to Chris.
Thanks, Leah.
Frank Conti is also a director with extensive experience in research administration and compliance. Frank focuses on human research protection programs and institutional review board, regulatory process, and software services, along with general clinical research program evaluation. So all of our HRPP, IRB, human subject protections related questions will go to Frank.
Thanks, Leah. Hi, everybody.
And then rounding out our panel is Nora Yin. Nora is a manager in our research services practice and supports our clinical research compliance team with a particular focus on clinical research revenue cycle. So all of our clinical research questions will be directed to Nora.
Thanks, Leah.
So I want to call attention to something that's on your screen and let you know that our research team has been incredibly prolific during this COVID pandemic to provide very actionable content for your use. You're seeing some of that on the screen. Note that you'll see some of these items have a new attached to it. We're going to provide this link and publish this link in the chat so that you can connect onto it during the webinar if you want to look at some of those materials. But also I encourage you to bookmark that link so that you can continually go to the link for other materials, because we are updating this on a very regular basis. So thinking about this session, as we approach today's topic, we're actually most interested in helping you think through the post-crisis stage of your research programs. From a compliance perspective, this to us means audit readiness. You know, it's not uncommon in the midst of a crisis to simply do what's right in front of you and get the job done. We talked about that as part of our readiness for the pandemic as our triage phase. You'll see that on the screen in front of you, moving from triage. We've got materials around that, then going to stabilization, and then finally hoping to get to transformation. But as we've moved through those steps, you know, when you're in the triage phase, you're focused on, you know, business at hand. But once that crisis begins to pass and things begin to stabilize a bit, it really becomes necessary to go back and think through how best to ensure that T's were crossed and I's were dotted, and fixing it where that didn't happen. You know, with the amount of federal money that's flooding into the various sectors right now, we really want to help you ensure that the integrity of those funds are sound and that your continued right to those funds are assured. So our plan for today's webinar is to set the stage for some very high-level comments on the current landscape, then move right into answering your questions and ping-ponging based on what the content is. So please send us your questions using the Q&A feature on Zoom. And we will work to get through all of those questions over the course of today's webinar. Many of you have already submitted questions, so we're just going to go ahead and get started. And Nora, I'd like to start with you to do some of that level setting. So with the understanding that most research institutions have begun planning for getting back to work, how are we seeing and how are you able to reflect how they're organizing those efforts?
Yeah, so we've actually seen various levels of contraction of activities and therefore different plans and approaches for ramping back up. So at the outset of COVID, majority of institutions formed a committee to organize their efforts around how to manage their workforce during the restricted times, and have continued to maintain the committees as they look to ramp research back up. And their committees included those from executive leadership, cross-functional groups representing key research areas, legal, HR, and even sometimes compliance.
So how do you see that they're approaching this? Like over what time frame? What are some of the challenges that clients are facing? And how are they dealing with those challenges?
Yeah, so not surprisingly, everyone's looking at some sort of phased approach. Their journey back is driven by how much research activity was shut down in response to the pandemic, as well as strategic and operational priorities at the organizational level. So in most cases, the transition to work from home for research administration functions such as pre- and post-award grants management, review committees, even those in clinical research administration, was relatively an easy one. But what we've heard from our clients that for these roles, working from home is likely to continue in the near to immediate term, and for some may even become permanent. With bench, animal, and clinical research operations, institutions found them much more challenging. Virtually all institutions are putting safety first. And so looking at all reasonable means to keep patients and staff healthy, the measures that we are now familiar with are what they're putting in place. Social distancing often requires reconfiguration of work areas and research space, which is already scarce. And so it will no longer accommodate the same number of personnel, but will be accommodated with staggering shifts. So with regarding timing, I think safety is invariably the primary driver. Institutions are eager to continue their research mission, but also making sure that they are also prioritizing those programs from a safety perspective, and it might even consider, what those mean for some financial component.
That's great. So any other takeaways or recommendations regarding getting back to work?
Overall, when, we've been talking with our clients, I've actually been very impressed by the courage and creativity displayed by institutions in response to the crisis. And so the courage to make difficult decisions with very imperfect information, not to let decisions linger in hopes of information that will make the decision easier. That behavior, I think, will really help sustain institutions through the next phase. And also examining the potential scenarios and outlining plans in advance will also help.
Yeah, thank you, Nora. And the only thing that I would add to that is from this compliance perspective and audit readiness is to document the decisions that you're making, particularly now as things are calming down to some extent and we're beginning to find a groove for clients to document what the decisions that they are making so that they can reflect back on that in the event of an audit. Thanks, Nora, appreciate that. So let's get to some of your questions. So Chris, I'm gonna start with you. We have a grants question. What approach should my institution take for sponsored communications related to research projects experiencing significant delays in progress?
Thank you, Leah. I mean, we all understand, and most sponsors at this point have acknowledged the possibility of significant research delays due to COVID-19. Most have asked that institutions connect with their sponsor's program manager to communicate the delay of the details and, as you made point to, internally document these delays as soon as they're identified. At this point, our recommendation is to implement some sort of internal identification mechanism to pinpoint all active awards that may be experiencing significant delays. What we've been trying to quantify there is, awards experiencing significant delays are likely 3 months or greater should be flagged, and the documentation around that should be saved kind of outlining what's caused the delay, what the current plan is to resume or complete research, and to kind of make sure there's been communication back and forth. Then kind of post-award grant administrators should proactively communicate with the program manager, notifying them of those delays. Proactive communication by institutions is really going to be crucial to avoid financial losses and future funding delays. We continue here on, like, all communication should really be saved. The documentation should also be updated with detailed notes on kind of what's causing it. We have kind of a few examples we can talk through and some of the suggested tools we're using to identify and track and communicate those delays with sponsors. First, creating a process internally to identify those delays, whether that's an institutional-wide email to PIs to identify those that are expecting or experiencing delays, or the creation of some sort of an internal live website where they can go and fill out a form to send that information to central research so that there is documentation that has been identified and there's a process to communicate that. Second, from a centralized standpoint, creating a standard formalized communication template that can be used to alert the sponsors when there are significant research delays. And then last, as we continue to talk about, making sure that once it's been documented, that there is a process of going through, tracking and monitoring those delays so that if it does extend or continues to have issues, or if research is able to resume, that's continued to be documented, tracked, and outlined so that it can be communicated with the program administrator.
That's great. Thanks, Chris. Good, very good guidance. So Frank, the next one I'm going to send is to you. So I'd like to know, what are the issues you're hearing from clients about the role of the IRB and HRPP in work that's coming in, those projects that are coming in? Can you give us just a very high level reminder of the regulatory landscape for IRBs? What's the jurisdiction of the IRB? Where does their role end, and where does that leave the organization in this new and challenging landscape with a changing regulatory landscape?
Sure, it's a really great question. Thank you. The short answer really is that IRB's charge hasn't changed as a result of the current pandemic. That charge is to protect the rights and welfare of human participants in research. That being said, though, IRBs are usually and pretty often charged with doing more than is required per the federal regulations that govern human subject research. The current public health crisis is stretching that even further, and institutions are leaning on IRBs in just different and new ways. Add to that the fact that over the last few months, IRBs have been asked to review treatment protocols and experimental treatments using mechanisms that they haven't really used or haven't used very much previously. And then also becoming familiar with new pathways for approval and review, things that are totally new to the IRBs, such as emergency use authorizations, which is something that has been used pretty frequently recently. That's not even to mention all of the investigator submissions that are looking at medical records or the social behavioral impacts of the COVID-19 pandemic. So all of this is in addition to the everyday work that IRBs have been doing and continue to do. So, and especially because research that involves therapeutic benefit has been ongoing at most, if not all, institutions around the country. So really it's an understatement to say that IRBs are busier than ever.
Yeah, certainly. So Nora, let's go to you next. And could you speak to some of the considerations that are really specific to clinical research and how institutions are looking to get back to work?
Yeah, definitely. So during the initial phase of the pandemic, which Huron has coined the triage phase, most institutions identified tiers and types of clinical research to limit those that were deemed essential. So for an example could be, research that involved a direct interventional treatment with no standard of care alternatives were deemed essential, and we're allowed to continue with in-person visits, ensuring that all appropriate precautions are in place. And so these same attributes can be used to prioritize their reinstatement and also to guide how and where the research activity is conducted. In general, benefit to the patient and risk to both patient and staff have been the key drivers for continuing research studies to date. And so looking ahead to revamping clinical research programs back up, these same considerations must be, in front of mind. Strategically evaluating which studies can open back up within the confines of safety parameters that have become society's new norm will be the responsible thing to do. And so studies involving vulnerable patient populations, such as the homeless and those who are incarcerated, will need to be carefully considered to ensure that study protocol integrity is maintained, while also at the same time ensuring that the health and safety of the populations and the research staff who need to interact with them.
Yeah, all of those things are so important, and sometimes it's hard to keep everything top of mind and try to manage through some of that. So what are some of the strategic considerations you're hearing from clients as they keep certain things front of mind as they're ramping up their research activity, understanding that the clinical research options may need to change in the immediate to long?
Yeah, so as I mentioned earlier, it's possible that research administrative functions may never return to campus this year. And so this also holds somewhat true for clinical research patient interactions that do not require a direct physical assessment or intervention. And so CMS has actually issued guidance on providing essential non-COVID-19 care to patients without symptoms in regions with low and stable incidence as part of the administration's guidelines for opening up America again. The guidance recommends a gradual transition and encourages healthcare providers to coordinate with both their local and state public health officials, as well as to review their facilities' readiness when making the decision to restart or increase in-person care. I think technology can also be an important enabler. And so to that end, I think investing in technology should be considered. There are tools that provide a means to allow patients to consent to participate in a study via an e-consent rather than a paper form. And then, with industry sponsors like Pfizer or Merck, they typically send their staff on site to review study records and ensure that data is being collected per the established protocol. We've heard that some of our clients have been utilizing their electronic health record systems like Epic, which has tools that can enable that function to be performed remotely, so that on-site monitoring by these sponsors do not need to occur or can be decreased substantially. And then I think, also coming to the realization that certain administration functions don't need to take place on-site may also pave the way for outsourcing services like those that our Huron Research Office provides, and especially in cases where fast turnaround is needed. And I wouldn't be surprised to see this actually happening in the upcoming months as, institutions resume to normal activities.
Yeah, the other thing you think about with respect to outsourcing is the pent-up research in the pipeline. That as things were halted, principal investigators and other investigators were very busy thinking about new things that they want to do. And so the IRB pipeline might be filled, the other pre-award activities, might be stretched. And so where there's some need for some support, we're obviously here to help with that. So the next is another grants question. So Chris, we're going to shift to you. Thank you, Nora, for the clinical research insights. So here goes. As an institution, what approach should we consider for charging salaries to grants which may have been impacted by research delays?
Thanks, Leah. This has probably been one of the most discussed topics as we've kind of shifted to these flexibilities that have been issued. And at this point, the federal agencies have issued guidance confirming institutions can continue to charge salary to federal grants in no work and low work scenarios, provided they have the appropriate policies in place. And I know I saw another live question come through asking about policies, and this is one of the first times we'll talk about a specific policy. Specifically, OMB states that awarding agencies may allow recipients to continue to charge salaries and benefits to currently active federal awards consistent with the recipient's policy of paying salaries under unexpected or extraordinary circumstances. So the key word in this is consistent. Each institution needs to review their existing policies to determine if any support an institution kind of charging salaries and benefits to all employees in low and no work situations due to COVID-19. We're expecting, kind of as you're going through this, we expect funding agencies may request copies of these policies to support charges that are made during the COVID-19 period. If your institution does not have an existing policy or a documented policy that supports continued charging of salaries during extreme situations, what our recommendation has been is adding an addendum to an existing policy rather than creating an entirely new policy. And at a minimum, there should be some sort of memo or communication that's drafted and distributed to the research community that documents what your institution's guidance has been for handling salary charges during COVID-19. Any memo should really clarify that charges are going to be handled consistently across federal and non-federal sources. Ultimately, the objective of spending flexibilities issued by federal agencies was to lessen the impact of COVID-19 on individuals and to help keep institutions afloat financially via continued cash flow. But that being said, there's still uncertainty existing around the future actions the federal authorities may take in response to various institutional approaches for leveraging these flexibilities. Given this uncertainty, your institution will need to determine what the financial risk is and what outweighs the compliance risk in defining what the approach will be for charging federal awards in low and no work situations. Huron recommends an approach that allows institutions to maintain salary allocated to active awards, kind of looking at your existing awards, your non-competing renewals, with some caution to assure researchers will reasonably meet programmatic goals, and recognizing there's no guarantee of additional funding if delays significantly impact the research progress. And what we're also saying is look at avoid charging idle salary to new awards, looking at those awards that have just started, or items like summer salary on existing awards, unless there is significant progress that can be demonstrated during kind of the COVID-19 or as part of the award setup.
Incredibly helpful, Chris. And so back to the theme of documentation and consistency, right? That you can't pick and choose what you'll charge and what you won't. And I suspect that there's a lot of pressure right now because this is one of the areas where the funds are flowing. And for so many of our clients, you think about where we work in two very heavily impacted industries of higher education and in healthcare. In our research team, that having a steady flow of money is attractive. And so for the compliance professionals on the webinar and those who are in research administrative positions is to make sure that your voice is being heard, to make sure that you're handling things. Consistency back to making sure that the revenue that you do have has some integrity to it and you can justify it. So a follow-up question to the one just asked, Chris, is how should we handle decreased effort and salary reallocations under both no work or low work conditions?
Yeah, instances of reduced work can be viewed, comparable to when faculty members take vacation under normal circumstances. If the faculty member's core responsibilities have remained the same, despite the decrease in work dedicated to the award, it really, we're looking at kind of keeping it as is. If a significant change occurs, it's recommended that you reach out to the sponsor and determine some of those appropriate actions. I'll give an example. So if a faculty member completely shifts their focus away from research due to kind of the inability to perform work due to COVID-19, or they dedicated 100% of their effort towards a COVID-19 response, under the current guidance, their salary would be allowable and could be charged to federal awards. However, in looking at kind of a different piece, if a faculty member shifts some of their focus away from an award to focus on other awards or duties that have more capacity for remote work, while continuing to work on the award in a reduced capacity, thinking about kind of COVID-19 limitations or the partial ability to contribute towards the COVID-19 response, in that case, we would suggest adjusting the salary allocations and effort reporting as you would in normal work conditions, given that they're shifting.
Great. Very good, very helpful guidance. And so just a word to the audience to please continue to send us your questions using the Q&A function on your...
Even though it is due to the remote.
Say again, Chris?
Did you guys lose me?
No, you're good. You're good. Okay. Frank, let's come back to you. And I'd like to hear what types of submissions is the IRBs seeing right now, and how are they focusing their time to triage some of that, and as they move into some more of the stabilization timeframe?
Definitely. I'll start with the fact that IRBs around the country are seeing a pretty big increase in requests for review of projects that involve public health surveillance data. This was a term that was introduced to IRBs in the revised common rule that went into effect in January of 2019. And per that revised rule, this is not research that falls under IRB purview, but guidance from the feds really, it specifically says the line between public health surveillance activities and research activities can be difficult to draw. The regulations don't give us a specific definition for what constitutes public health surveillance activities. And the guidance further goes to say that there is no requirement that an IRB must make the determination of research versus public health surveillance, but the decision needs to be thoughtful and deliberate. And so when we ask the question, who within the organization is best prepared to make this determination, more often than not, the IRB is the logical place to stop. And note that I'm being pretty careful to not say that and provide a specific recommendation that the IRB should be that place. Really, it's an institutional decision that leadership in partnership with the IRB and other areas should really carefully consider before making a decision. Then having a specific process for review of these projects before implementation is really important as well.
Yeah, and so, you know, this can be a fine line, right, Frank, that there's a point at which regulatory obligation ends for an IRB, but from your opening comments, there's a lot that comes to the IRB that's not regulatorily mandated, and decisions that IRBs are put in a position to make, a lot of gatekeeping responsibilities that really aren't their obligation to do. But again, they have a particular expertise. So it sounds like you're really talking about a partnership between the IRB and other areas within the organization. Can you speak a little bit more to that and speak to how does the IRB continue to maintain as much of a bright line as they possibly can around this is an obligation that the IRB has, and so we own this, versus this is the IRB acting as a partner in providing guidance around ethical decision making?
Yeah, that's exactly right. IRBs in compliance areas really are a huge asset to the institution in a lot of different ways. So take, for example, decisions on antibody testing your workforce as folks come back to work or come to work in general. There are some decisions that need to be made, but not necessarily by the IRB. A lot of decisions around, does this make sense? Are we doing it for research? You know, what are we doing with the results? All of those kinds of questions. So the decision on whether or not to do that antibody testing of the workforce doesn't necessarily need to be made by the IRB, but the IRB team, your IRB resources, should be part of the decision-making process, and they can provide valuable insight as to when you know, those types of procedures cross over that very gray line into research requiring IRB review.
Great, that's great. Thanks, Frank, incredibly helpful. So Nora, I'm gonna shift to you next on this next question is, to what extent should institutions continue to process studies in their clinical trials pipeline? We talked about the backup in the pipeline, and how do they do so with the knowledge that resource constraints exist, some significantly, in some areas where there are some inherent dependencies?
Yeah, So the prioritization of resources for clinical care needs and studies deemed as essential continues to be of importance. And so once these needs are prioritized, the available workforce should continue to process the clinical trial pipeline at a reasonable pace, with an understanding that regulatory personnel and IRB committees may not have the immediate bandwidth to process those non-essential studies in the pipeline. And so while continuing to develop coverage analysis, study budgets, and contracts for clinical trials in the pipeline, I think this period of slower activity is an ideal time to actually cross-train these pre-award personnel to assist with both study startup or study maintenance efforts, related to regulatory affairs management. I think this approach would really prove beneficial in terms of building a capable cross-functional workforce to assist with non-patient-facing responsibilities to ensure the continuity of research. And we started to see some of this kind of change happen also within our clients.
That's great. Okay. Chris, back to you. How can institutions ensure expenses incurred related to COVID-19 are appropriately allocated to sponsored research awards?
This is one where, as guidance continues to kind of come out and the line changes, what we've recommended is using or implementing kind of a tracking mechanism within your institutional financial system to flag COVID-19 related transactions on your research awards. If existing functionality cannot be utilized to have some sort of a transactional flag, you can also look at the creation of child accounts, associated projects, or we've seen a few kind of institutions that have actually put in new general ledger expense accounts to track COVID-19 related expenses, specifically related to salary, like we talked about earlier. What these tracking capabilities provide are controls to segregate those costs and to make it easier to identify, report on, and review those charges as COVID-19 guidance evolves. What you really want to be doing is monitoring those charges, gauging the financial impact if charges are deemed unallowable in the future, and also using kind of those reports and those numbers to take a look at if there are additional funds that are made available in the future, being able to make a specific request for those funds. In addition to implementing a tracking mechanism, some of the other things we think should be considered are looking at associated procedures and communications to provide clear guidance to the research community on what is and is not allowable and how to use the tracking mechanism. Requiring justification and documentation of how the expenditure is a COVID-19 related cost. And specifically what we're looking at there is kind of looking at the repurchasing of supplies that were lost due to COVID-19, whether it expired or couldn't be used, looking at the rebooking of travel costs or cancellation costs. Also, looking at establishing a practice for monthly review of COVID-19 related costs at a department and a central level, making sure that those are still allowable costs. As we talked about earlier, having standard reports that would allow you to review these costs. Also making sure that, as always, kind of processing necessary cost transfers in a timely manner. Making sure you're reviewing and closing awards on time. Making sure that you're doing kind of a monthly review of active projects and performing those closeout reconciliations can really help make sure you don't have any unexpected expenses that kind of come through at the end. So there's really a lot, it kind of follows what we've been talking about. A lot of these are good audit practices in a normal circumstance, but it's become even more important as we evolve through COVID-19 and the guidance changes and we get different kind of guidance from all of the sponsors that we're able to quickly review and identify those expenses that may or may not be allowable in the future.
That's incredibly helpful and very actionable guidance. So Frank, the next one's for you. So question is, are you aware of templates for 46.116B2, very specific question, 46.116B2, descriptions of reasonably foreseeable risks related to COVID, or in-person or face-to-face study activities that an IRB should require be in place for consent materials?
Yeah, that's a really good and really interesting question. So 45 CFR 46.116 are the regulatory requirements related to informed consent of research participants, and B2 specifically talks about risks to subjects. And so this is really important because obviously if research is continuing, there may be additional risks related to the pandemic for research participants. That said, what I think IRBs really want to get out of the business of doing is re-reviewing every currently approved study to add additional risks related to COVID-19. Like I said earlier, the volume of work and the type of work that IRBs are currently doing it's grown a lot. And so, basically saying that each investigator needs to add terminology to their informed consent form individually would cause a pretty substantial number of additional changes to approved research. So what I've instead seen is organizations or IRBs in general saying that if research is continuing, so those right now, generally those projects that involve therapeutic benefit, there might be an information sheet that is IRB approved that just kind of goes along with all of those consent forms that provides that additional detail for the risks related to COVID-19. Chances are if those folks are coming into the clinic or the hospital or the institution, they're already getting that information in another way as part of their normal treatment consent as well. So it's really thinking of it a little bit bigger picture than just this particular individual research study, and what is the institution doing, how are they communicating that, those additional risks to everyone, because that's just not a risk specifically related to the research project itself generally.
Helpful, and it's important just to keep that perspective in mind, right? Because if the IRB tries to issue its own guidance, there's the risk that it could conflict with the institutional guidance, and then you are creating a problem rather than solving one.
Right, and let me also add that, everybody I think in the nation knows how rapidly the situation has evolved, right? So what we approve today, if you were to do this on a one-to-one basis per study, what we approve today may not be what we want in the consent forms and those addendums next week or in a month from now. So even if we took the initiative to re-review every single approved IRB project and add specific COVID-19 language to the consent form, we would likely have to do that again as the information changes. So having an organizational template makes a lot more sense.
Great, thank you. So Nora, your turn next. We are having some questions about telemedicine. You've mentioned the prioritization of clinical research studies and essential versus non-essential, and that has meant that there have not been activities, one-to-one interactions live in person for clinical research trials. And so as shifting from that face-to-face interaction and moving to telemedicine, and as those capabilities become even more mature and the funding is there for that, what do you see as some of the compliance considerations that organizations should be taking and considering as they're looking to do more telemedicine?
That's a great question. Yeah, telemedicine has been top of mind and really been applied, since the pandemic started. And so, as telemedicine and the use of actual virtual tools become more integrated with clinical research, it is important to reevaluate the controls and the priorities on a continuous basis, especially as the environment shifts in the upcoming months. And so ensuring appropriate digital guidance and materials have been created with HIPAA regulations in mind, and that they have been clearly communicated to research nurses and coordinators to use in this virtual environment will be very important. Also ensuring that the digital platform itself used for telemedicine are secure and includes the consent for research patients assigned prior to joining their appointment, allows for critical risk mitigation. Compliance will need to plan for how monitoring of telemedicine should be incorporated in their risk mitigation plans, starting now really, if they're to plan for the upcoming months. And something just to mention from a financial perspective to kind of keep those people wondering, what about it from, cash flow perspective as it relates to telemedicine. CMS actually allows healthcare providers to receive accelerated and advanced payments to address the cash flow issues caused by COVID-19. And so payment for telehealth services are actually considered the same as an in-person visit. And so there's not really a loss from the institutions if they do conduct telemedicine versus in-person visits. And so that's actually something that I thought was quite incredible when CMS released that guidance, that they would be paying for the same amount. I think there are over 80 approved telehealth services that can be done either via video or phone call. And then actually with that, Medicare has reduced the processing time for reimbursement to, I think, a maximum of 7 days as opposed to the typical 3 to 4 weeks. So a lot of institutions have been able to capitalize on this new regulation and be able to help manage their cash flow.
So that's incredibly good news, right? Because so many places, particularly in clinical research, our hospitals and AMCs and healthcare systems have been so significantly hit, their revenues. But it sounds like there's a real need from a compliance perspective to ensure that the PHI is protected and there's information and data security. So that's great. Thank you for that. Frank, next question is for you. So how is it that IRBs are approaching the requests from the research community to reopen? For those who are coming out of their triage stage, looking at some stabilization and looking at how they're going to begin to reopen their research programs, what's the role of the IRB and how are they handling that?
Yeah, it's a great, fascinating question, and it's really varied with institutions around the country. So as I mentioned before, most organizations have paused research that does not involve a direct therapeutic benefit to those research participants. So the request to restart those research projects without the direct benefit to participants is really on the institutional leadership, not the IRB necessarily. I've seen some IRBs have conversations and debate, on an individual study basis. So related to the previous question, what types of PPE is appropriate? Does the investigator's protocol include cleaning and disinfecting protocols? And those types of things, which really, again, are decisions that the organization should be making at a higher level. If the researcher is abiding by those policies and standards, then it's outside of the IRB purview. They're just abiding by hospital or institutional policies that are going to be shifting over the next couple of months. Really where IRBs need to be focused on are previously approved research. So I've heard from a number of clients that some investigators just haven't been submitting a whole lot of modifications to their previously approved research studies. So for example, changes to those projects from sponsors, or some have gone radio silent on responding to the IRB for, with outstanding issues from initial review, or modifications to approved studies. So what I think that means is that at some point, all of these researchers are going to come knocking on the IRB's door, probably around the same time when the institution starts freeing things up a little bit, and looking for quick responses. So the question that I think is really important is your IRB prepared and ready to handle that volume when that time comes? Is the IRB doing everything that it can to minimize the administrative burden, both on themselves and on the researchers? So using the least restrictive review level for studies, so not sending studies to the convened board that can be reviewed by expedited review and those types of things. Those changes will allow IRBs now. Changes now will allow IRBs in the future to streamline their processes when all those researchers come knocking and wanting quick responses. Another issue that I'm hearing from clients and something that folks are really thinking about is related to their electronic systems. So are they able to be fully functional working remotely? I think a few months ago thought this would just be a few weeks or a month of working remotely. Now we're hearing institutions with the administrative functions planning to work indefinitely remotely. So it was fine for a short period, but are we really in the best place that we can be for the future? So can investigators really quickly and easily access their submissions? Can IRB staff do everything that they need from home and those types of things? it's really critical if for those institutions that don't have a streamlined system, or believe it or not, the handful that have an entirely manual or paper-based process. There's still a number of those organizations, even some fairly large organizations that do things very manually. So those are some of the really interesting conversations that I've been having lately.
This has certainly been a revelatory time, right? All gaps and fissures are really coming to the surface in the research programs of where things had been dealt with and managed through when somebody was in the office or the cube next door. That it's a little harder to do that now. And so, Nora, the next one's for you, and thinking about things reopening, the pressure on the pipeline building, the push to publish, the push to submit new awards. How have research misconduct matters been managed during a time when people are just looking to get things done?
Yeah, there's certainly a lot of risks that I think could really come with prioritizing speed over compliance. I think as many as, as compliance folks know. And I think it's more true, especially during this time when everything is moving so fast to keep up with COVID clinical trials. And so I think the risks associated may pertain to falsifying data or otherwise messing with results. And this can really actually apply to even non-clinical type studies. And so, technically when we think about what research misconduct is, it really only applies to PHS funded research, but I think the ethical principles should apply generally. And so it is worth actively re-communicating with the research staff that ethical conduct of research is still expected, including disclosing financial interest and adhering to scientific standards for the conduct of research. I think everyone has an obligation to carry out research ethically, even if there are distractions related to COVID trials for those that have those at their institutions. And so it helps to remind research personnel of how they can report concerns about research misconduct, whether through the hotline, direct reporting to the research integrity officer, or even directly to the compliance personnel.
Yeah, that's great. And to think through now for research integrity officers and compliance professionals, even research administrators, to think now about how you would handle a research misconduct allegation, recognizing how time sensitive those regulations are, will be time well spent. Chris, next to you, here's the question. What should my institution do for PPE, personal protective equipment, supplies that were actually originally purchased for projects, but have been utilized later in donating them to COVID efforts? So they were purchased for purposes of a sponsored research program. They were later donated. What should organizations be thinking about, and what should they do about that?
Another specific question, and we've had this come up actually a few times in the last few months. Typically donations are an unallowable cost. However, due to kind of the public health emergency, some agencies are providing flexibilities in spending and consider these kind of other costs that may be potentially allowable. A specific example is the NIH in one of their FAQs, I think it was number 6, indicated that recipients may donate PPE and other lab supplies in order to support COVID-19 efforts. The recipients also could rebudget grant funds to repurchase supplies at a later date, or submit an administrative supplement request to the funding institute or center. The note with that being, institutions should not assume additional funds will be provided to repurchase those donated PPE supplies. So really in doing that, you want to confirm with individual sponsoring agencies that have not issued blanket guidance like that, as agencies will review situations on a case-by-case basis. That being said, what we've recommended is, if you are in this situation, that institutions create a standardized form to track all PPE donations, capturing required information that you would expect to have for audit and a closeout reconciliation. And the information that we're suggesting is your original purchase information, including the date, the quantity that was donated in order to kind of assess a dollar value, and then who the recipient of the donation was, including assurance that the PPE supplies were donated for COVID-19 purposes and not applied to personal or another use.
Very good, Chris. A specific answer to a specific question. Thank you very much. So it looks like we've covered the questions that were posed on the Q&A segment of the Zoom. So I want to call the audience's attention to something that came out from the OIG on Tuesday of last week. The Office of Inspector General for DHHS published the OIG Strategic Plan Oversight of COVID-19 Response and Recovery. It outlined 4 goals: protect people, protect funds, protect infrastructure, and promote effectiveness of the HHS programs now and in the future. Throughout that piece, OIG talks about audits, investigations, and enforcement. So back to the opening point, I think we all need to be audit ready and prepared for in some level of audits, investigations, or enforcements if there are any questions. And the best way to buttress your programs is that documentation and maybe doing a probe audit here and there as things begin to calm down. And so this is an area where compliance professionals are really in a position to be a trusted business partner with a seat at the table during these very critical decision-making times. You know, partner with your colleagues who are struggling with just the day-to-day management of their programs and changes in business processes, trying to manage staff remotely where they're not used to doing that. And finding new areas of funding. You know, administrators and directors and those in managerial positions and even the frontline staff are busy doing those day-to-day things. Compliance at the table can be helpful in documenting some of this and being a partner to help with documentation of those decisions and the considerations that led to those conclusions that were reached for the organization. And working together to really ensure that controls are strong and that the organization is really ready for that inevitable audit. And then it serves to solidify the relationships for years to come. And certainly now more than ever, there is an identified need, back to that kind of revelatory aspect of the pandemic, an ongoing need for enterprise risk management programs. We're finding that those clients of ours that have had mature ERM programs were able to respond much more quickly. They had the infrastructure in place to be able to manage and address and deal with some of the issues that have arisen. And so that is certainly something on the agenda list for those that either do not have enterprise risk management programs or they are not as mature as you're finding they may have needed to be. Final reminder to check out the resources page that is on your screen. The link is in the chat so that you can access that, and just a reminder to bookmark it because we are very regularly updating those materials. So thank you to the panelists. Thank you for those of you attending, and Grace, I'll turn it over to you.
Perfect. Thank you so much again, Leah, Chris, Frank, and Nora for your excellent insights today. And thank you all for joining our Compliance Moving Forward during the COVID-19 pandemic webinar. We will be making the recording available to you all in the coming days. So keep a lookout in your inbox for that. And I hope everyone has a wonderful week. Thank you all again for joining.
Take care.
Thanks, everybody.
Thank you.